Opioids, the ongoing epidemic.
The United States and the state of Alaska are facing a crisis right now. It is known as the opioid crisis. This term refers to the alarming rates at which the use of opioids and opioid-related deaths are increasing. So what is an opioid? An opioid is a drug that when it enters your bloodstream, it travels through your heart and into your brain. There, the opioid molecules attach to receptors in the brain, relieving pain. The most common form of opioids can be received legally through a doctor's prescription, but once your dealer stops supplying, individuals will look to the streets to satisfy their needs. Just to give you an example, in 2015, 12.5 million people misused prescription opioids, and 1 in 3 Americans were prescribed opioids. Furthermore, an additional 828,000 people abused heroin, and since then, trends have been increasing. So how does this addiction occur?
Imagine you are playing on a football team and you get a very nasty injury during the game. Your leg is broken and it requires surgery. Eventually, you get the surgery, but even then, all is not right in your world. The pain doesn't go away. In fact, it stays and it gets worse. Then your doctor decides to give you painkillers to deal with the issue. Eventually, you develop a dependence on them. You need to slowly wean yourself off of the painkillers in order to avoid a severe addiction. Here you have 2 choices. The first choice is to try and fight the addiction. You can go to the hospital where they can treat you and give you help. It won't be easy, but you can beat the addiction. The second choice is to find other sources to feed your need. Enter heroin.
So let's see what happens when you go down the path of immediate recovery. How do you do that? There are a few options. They have treatment which lowers your craving, or in some cases block the opiate receptors in your brain. There is also cognitive behavioral therapy. These treatments modify the user's association with using drugs and reduces the mental urge felt by those addicted. All of these options take time and money. There is no quick fix to heroin addiction. Let's go down a different path. Let's say you decide to keep using painkillers. You go and find a guy who knows a guy, and he gives you some stuff that will make you feel better. You get home and try it, and you feel good. You have a sense of euphoria. Everything feels floaty and your pain feels far away.
So what just happened? Well, when heroin enters your bloodstream, whether via the lungs after smoking, via the nasal passage after snorting or inhaling, or directly into the bloodstream by injection, heroin creates a powerful sense of euphoria once it hits the bloodstream and turns into morphine. It travels through the bloodstream, heart, and eventually the brain. Not only did you get all of those great feelings, but now you've become addicted. That's right, you can become physically addicted to heroin after using it just one time. Now, there are 2 types of addiction, mental and physical. A mental addiction is only a strong mental urge to experience the new drug again. However, in physical addiction, not only do you have that strong mental urge to do it again, but physically addicting drugs like heroin cause your body to react physically to the lack of the drug. It is also much more difficult to kick than a mental addiction. So, when someone comes down from heroin, they feel the effects of withdrawal very quickly. Often you have a lot of dry mouth, weak knees and arms, and you vomit a lot.
You have continued using heroin and now have become severely addicted. What happens now? Well, after some time, you'll start developing insomnia. You can have health complications with your lungs as well as kidney and liver disease. And remember how at the beginning we said that heroin travels through your heart? Well, heroin is not a very heart-friendly substance, and in some cases it can destroy the valves of your heart or result in infection. All of these issues will have lasting effects on your long-term health if you try to recover now. And if you thought recovery was bad before, now your body has adapted to constant heroin exposure, and when you stop, your body freaks out in a really bad way. You can start suffering from severe anxiety, constant nausea, and frequent vomiting. Uncontrollable sweating, constant aching in the body, and increased sensitivity to pain.
Okay, so you've been addicted for a while. Instead of deciding to try and stop, you decide to double down because you've come this far and stopping is really hard, so why try? What happens? Well, the long story short is that you die. If failure of one of your organs doesn't kill you, which it most likely will, then there is also a chance your body just straight up forgets to breathe and you suffocate.
So why bother telling you all of this? We're bothering because there is a serious issue facing not only the state of Alaska, but the entire United States of America. The chances are you've come into contact with or know someone who has used heroin or opiates, or is at risk of abusing painkillers. If it ever comes up, we want you to know what it can do to you and why you should avoid it at all costs.